Good morning. We have a young woman here who's had children and she's lost volume in her breasts. So what we're going to do is we're going to do a breast augmentation. We're going to place the implant above the muscle because, again, she has a very relaxed skin brassiere. She does not want to have any lift. So what we're going to do is actually use her skin brassiere, fill it up with a beautiful implant, an Inspira. It's a highly cohesive, smooth silicone gel implant. And what we're going to do is develop the pocket now. We've just begun inframammary incision, and now you can see this is the breast tissue, and this is the muscle. I want you to see how I'm going to develop the plane right here. It's a beautiful plane, and I'm going to dissect right in this line right here. We're going to make the pocket so she gets cleavage, she gets upper pole fullness. So she's going to have a full upper pole, she's going to have cleavage here, and then she's going to also have fullness laterally. And it's going to look very natural, like they're beautiful breasts that are her own. We have dissected the submammary pocket, so the pocket is actually below the breast. This is her breast, you can see. And this pink is the muscle. This is the pectoral muscle. So we're going above the muscle because this patient has a very loose breast. You can see how she doesn't want to lift, so we're going to fill the entire, we call this a skin brassiere, and we're going to fill that up with the implant. But we've made the pocket, so look, you can see she has cleavage. It comes along the fold right here, so she has cleavage along the sternum, and then we're going to actually make an internal bra here so the implant is secured and actually lifted. She's going to have lateral fullness, so you can see the pocket here is nice and free, and we're going to be sizing her to make sure that she gets the right implant size and shape, so we don't just stick them in any size. We actually customize the size and match it with the other side. So we're going to dissect the pocket on the other side and then put the sizers in, and we'll take you along the story as we go. So we've done the breast augmentation and we're doing the sizing now. I'll take a forceps. I'm going to show you how she has the sizer is in. This is a 495cc Inspira. It's a smooth, cohesive, extra projection. It fills the entire pocket. We made the pocket and the implant basically be like it's a kid glove, a hand in a kid glove. It's very, very snug around here so that it just doesn't prevent this from moving. Stays on the top of her chest. She gets cleavage, she gets fullness, and then she gets upper pole fullness. So we're going to put her up right now. So you can see from below, Michelle, show how, and this is the non-augmented breast. We've made the pocket already, but we haven't put a sizer in there to match it up. So here you can see she's coming up now, and from the side as well. We don't want it to go higher than the second intercostal space, so look at that, how beautiful that is. She wants a lot of upper pole fullness, so I think this is a pretty good size for her. We'll be still matching her up and seeing what's the best. So we've placed the sizers in. They're above the muscle, remember, and we have a 495 here. This is a full projection sizer, and then I have a 525 on the left side. She wants to be as big as possible. She wants to have as much fullness because she wanted to avoid a lift. So we're going to go pretty much with the 525, but we're putting a 525 on this side and seeing how they match. But this is how the process of how we get to the customized breast shape and size for each patient. So now we have the real implant, 525, smooth, cohesive, extra projection. This looks beautiful, beautiful pocket, beautiful contour, cleavage. So here we put now the 525 sizer to make sure that this matched, and it does very well. So we went from a 495 to a 525. We're going to put her up. You can see from below how beautiful it looks. And doctor is putting her up, and we can see, look, they match very well. And you can see how nice this fits the entire pocket. Here's the second intercostal space. And again, I told you I'm going to close underneath to give her a little bit of a lift with an internal bra closure. Now put both implants in. We have the Inspira. It's the smooth, cohesive, extra projection, 525 on the left, 525 on the right. You can see how beautiful this is. Good cleavage, good upper pole fullness, lateral pole fullness. We're going to again anchor this here like an internal bra so that this stays and lifts her and stays on the top of the chest. We don't want it to go to the side of the chest, right? We want them on the top. Petty cleavage right here. And what we're going to do is put her up now, and you can see what she looks like sitting up. And again, I'm going to be securing these in place, but it looks very symmetrical, good cleavage, and I think she's going to be super happy. This is exactly what she ordered. So I wanted you to see how we're making the internal bra. So we have the implant here, and this is the chest wall, so there's pectoral muscle here, but I'm not closing the incision. All I'm doing right now is I'm just taking a stitch and anchoring the inframammary fold down to the chest wall. So this basically cannot fall down. This is going to actually hold it up and be like a natural lift. So we have it now suturing into the muscle fascia and then coming up through the subcutaneous fat and then locking it, and this is going to essentially be carried across, and it's going to anchor this down so that this is going to fall on top of it, and the implant will be secure and actually lifted. Then I'll close the incision. We've already closed the incision. You can see here on the opposite side. So look how beautiful, and the incision really is, I mean, it's about 4 centimeters, which is like 2 inches or so, but it's very small for the large 525cc implant that we have in, because that's important. We don't want to make a big incision. We want to make it as small as possible, so the scar is small. So we finished, and you can see how beautiful, look how small the incisions are, look, right there. And then you can see how beautiful she has the petty cleavage here on both sides. Look at that, that's gorgeous. And then the upper pole's full, the cleavage is full, the outer pole is beautiful. And then this was lifted. We saw how I sutured down and did the internal bra right here to kind of underwire inside to hold her, not truly an underwire, but sutures that create an underwire type effect to hold her breast up. And now we're going to put her up. And you can also see from the side while we're doing that, I'll give you a little background. And here she comes up, and you can see how beautiful. Look, she has 525cc, the highly cohesive gummy bear implants. And there we can see, this is as far as we can get her up in the OR, but tomorrow she'll look gorgeous as she's sitting up naturally. But it looks very good. We're happy.